it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com. And today I'm going to talk about my scripting for a common question. And that is when you have a kid or a teen, and perhaps you do braces in your office, but you also do aligners or Invisalign. And the parents are on the fence. They are not sure which one to pick. Maybe they're leaning more towards the fixed, and the patient is leaning more towards the removable or the Invisalign. So let me help you with some scripting so that you can help to, um, perhaps encourage the parents to consider a removable option. And I think this takes time. I mean, it really takes time. I think what has really helped is that Invisalign has done a great campaign towards teens and kids. It's definitely out there. Kids and teens are seeing it. The parents may not be seeing it. I know from experience that kids and teens are amazing with Invisalign, and actually they're better than adults for the most part. So I have no concerns. For me, I like to get to know, take 5-10 minutes to get to know the family, to get to know the kid, to get to know the teen. And that tells me a little bit more, if they're a good fit for it. But for me, first thing I do is I make sure the parents and the teens understand the difference, Some people think that Invisalign is slower, and that is not the truth at all. Matter of fact, if anything, except for a few one-offs, it's faster, hands down, because you are changing trays every 5 days, every 7 days. It's very predictable, especially if you're doing a good treatment plan. So that's a no-brainer for me. What else? I like to get to know the kid. I like to find out what they do. Do they go to school? Homeschool, real school. Do they play sports? If so, what kind of sports do they play? Do they do music, drama, instruments? So, and that helps me help them make the decision. We're going to talk about in a different video that I'm going to post today about the occasional one-offs where braces might be better, and also the occasional one-offs where Invisalign might be better. But for the most part, it's all equal in terms of outcome. We're still going to get the same great outcome. It's just all about the experience that's different. So you got to remember that most of the parents now probably were braces patients. It's shifting, but Invisalign really didn't start becoming a quality product, in my opinion, until maybe about 5 or 6 years ago. Before that, it was definitely inferior to braces. So these parents are thinking, well, I had braces and it was good enough for me, and so it's good enough for my kids, first of all. So that's something that you have to kind of change their mind about. That's true. But let's talk about the risk. Let's talk about the experience. Let's talk about everything you hated about braces. And do you really want your kids to have to go through that? And I can definitely talk about that, Number two, about the whole experience and comfort level. Definitely Invisalign has way lower forces than braces. Invisalign is changed every 5 to 7 days in a team, whereas braces are tightened every 6 to 10 weeks in a team. The forces for braces go up and down, almost like a sinus wave if you look at my mouse here. So, they're really high after you do a tightening, and then they go gradually down. They do tightening again, they shoot up. Well, actually, those undulating forces are actually not healthy for your teeth. It causes more root resorption and other blunting and other kinds of symptoms, as well as the discomfort that you feel is severe for a few days afterwards. I mean, I totally remember, of course, I'm an orthodontist, so I've done this enough times, but I totally remember the 2 times I had braces, the severe discomfort after having my braces tightened, and you get all this empathy from your classmates, and because you're eating yogurt and soft foods and mushed up things for lunch for a few days afterwards. And of course it gets better, and then it happens all over again, a month or so later. So, and it's not fun. And that discomfort that you're feeling is the high forces. Well, those high forces that can damage your roots. And I can tell you straight out, I probably had the best orthodontist in the country as a teenager. He was literally the president of the AAO, extremely well published, ran an orthodontic residency, good family friend. I'm not going to say who he was, but literally all my front teeth roots are destroyed from the high forces and the high wires and I don't know what he did. I only had him for less than 2 years, but evidently the forces were way too high for what my body could handle, and I have no roots left, completely burnt off. So from all the power chain and everything like that. So, that discomfort is telling you something. It's really not healthy. In addition, any hygienist can tell you this. it is very, very difficult to clean and brush your teeth with braces on. It really, really is. It takes me, if there's a patient with wires in, 10 or 15 minutes to get them clean. I remember even as a patient spending a good 15 minutes a day, getting out the floss threaders, doing this, getting the proxy brush. It is a lot of work to clean all around those nooks and crannies. And the vast majority of teenagers and kids don't do a good job. And that's just something that we accepted it, because that was the only option for straightening teeth. But now that there are other options, I'm thrilled that there's Invisalign and clear aligners, because I had so many patients that had scarring, decalcification, surprise decay when they got their braces off, It's really, really hard to do it. And, all of you who have teenagers, you know that you can't really do it for them. They have to do it themselves. I mean, they're not going to let you do it. So a little kid, maybe. So hygienists really prefer Invisalign. They don't want to clean around that either. I've seen so much nice enamel destroyed, not as much in my patients because I was really strict about hygiene, but in other people's patients, and they'd be like, they have these white scars all over their teeth. And I don't ever want to see that again. So that and the root resorption and other things. So in any case, I'm definitely much more of a fan of aligners than I am of braces for that reason. So I think it's a matter of just explaining the risks of braces to the parents. Often they're completely unaware of the health risks, as well as the benefits. And then talking about the whole experience, not only the lack of discomfort, but the fact you don't have any food rules. From a parent's perspective, I can tell you, having kids that have had aligners or had a few things, stuck to their teeth. I mean, no, you can't eat that. You can't eat that. You can't eat that. We got to cut this up. If you go to the movie theater, you can't eat the popcorn. You can't eat the candy on Halloween. And, when things break with braces, it's an actual emergency. You've got pokey, uncomfortable wires. The kid is bleeding. They're swelling. I can tell you stories of where there's been kids that have been in car wrecks of patients of mine that, were in car wrecks or whatever, or bicycle accidents. And, here I am talking to the oral surgeon at the hospital, trying to figure out how to get all my, hardware out of their cheeks. It's pretty scary stuff when they get into accidents, so there's definitely a lot of risks for sure. And the nice thing, and also, if you're playing musical instruments and you've got braces, a lot of them you can't play. It completely wrecks your lips. I remember I had to get my braces taken off before an orchestra or something because I was playing oboe and it was just wrecking up my lips. So just got all kind of things to think about, in terms of sports, trauma. So anyways, you get the idea. I find that the vast majority of kids are extremely responsible when they're given a choice. We need to straighten your teeth. Yes. 2 different ways we can do it. Let me tell you about it. This one, it has to stay in your mouth all the time. It does, You can pop it out to eat, or you can leave it in to eat. Sometimes if the patients want to leave it in to eat, I'll just slow the treatment plan down. I'll double the aligners. We'll do 3 or 4 day changes so they can just leave it in to eat. And then, they take it out when they get home and brush and floss really good. And then they put it back in. But that way you're not losing the aligners. It's not a big deal. The vast majority of kids and teens are extremely responsible. And, if they lose one, you can just reorder it. You just push a button. It's not a huge deal. And they go back to the previous one or they advance to the next one, depending on where they are. It's not a huge deal. It happens, I think it costs like $10 to replace a aligner. Usually before the teen came with a few freebies, but now my daughter just lost. She broke an aligner, had to get a new one. She's in Invisalign. And yes, they do charge you. So my bill was $35 for 2 aligners with shipping. That's how much it was. So just letting you know, I think the shipping was about $15, which is kind of ridiculous in my opinion, but I wasn't too happy about that. But, it happens. But, in terms of how you want to practice, we're going to get into this more into another one, but, broken brackets take up a lot of time, a lot of chair time, and they are actual emergencies. The parents get upset, and you can just erase all of that emergency from your practice. It's just going to make things a lot easier. Anyways, hopefully this was helpful and it gave you some good scripting, but the vast majority of kids are awesome at Invisalign. And worst comes to worst, you can always have a small upgrade fee if they decide to switch from Invisalign to braces, I mean, it's not a big deal. Some doctors do it for free. I don't think I would do it for free, but because I know the kids can do it. Just leave it in your mouth all the time. It's not that hard. All right. Thanks so much.